Dr. Sayaka Takeuchi, thank you for all you've done for the Mighty Heart Project and all you've done for Mighty Heart's team, myself, Michelle, and Nate. Thank you so much. We are so fortunate to have this amazing opportunity in conducting this interview with you. So members can find out more about mitral valve disease and important topics and other vital information concerning the surgery. So we have quite a few topics to ask you. The first one is, how long have you been with the Jasmine Clinic and what is your role at the Jasmine Clinic?
Sure. I've been with Dr. Masami at the Jasmine Clinic since 2015. So it's almost going to be 9 years in total.
Wow.
Yes. And my role is to work as a cardiologist at this clinic, as well as I see patients for traditional Chinese medicine. Because of my background, I also deal with all the overseas clients.
So international folks are usually eager to start the rabies because of the 180 days wait, the quarantine to enter Japan. Now, most are on board doing this as they wait for candidacy. What are your thoughts on this, please?
I think it would be a good idea if your dog is already in a very advanced, what we call stage B2 or C or D patients. If the patient is still in just diagnosed stage B1, early stage B2, you may want to wait until the disease progresses a little bit further, because some patients do not always end up with huge heart or in stage C where they go into congestive heart failure.
So you think, just explain a little bit further about the 180 days wait. Why would that be? It would be better to wait because?
Because once you are in advanced stage, the disease condition can just suddenly change overnight.
Mm-hmm.
And even if you want to get to Japan, there's always the quarantine barrier.
Yeah.
So it's always best to start the quarantine process when the patient's disease progress to an advanced stage. Then you're ready to travel to Japan when the disease really becomes severe and requires surgery.
Understand, yes. Please explain the candidacy for surgery, such as enlarged heart and other criteria you might consider.
At our clinic, so our surgical candidacy criteria, anyone who's above stage B2 with advancement, stage C, and stage D. And stage B2 advancement means you've got enlarged left atrium, left ventricle, and the regurgitation of the mitral valve are severe. And you adjust the medications, but these sizes or the amount of regurgitation continue to progress. So that's the stage that we would recommend surgical intervention.
So you say from B2?
Advanced B2, not B2. Early.
Okay. And could you please specify the reasons why some patients might get turned away from the surgery? What other diseases or conditions could impede the dog having the mitral valve repair surgery?
So as I mentioned, anyone who's in milder stages of the mitral valve disease, so stage B1, early stage B2, we do not always recommend surgery because of the invasiveness and sort of life-threatening complication that it has with the mitral valve repair surgery. So that's why we always opt for medical therapy before considering surgical intervention. And other condition that may preclude patients from becoming a good candidacy for the surgery would be anyone who has diseases that are life-limiting, such as cancer, immune-mediated diseases, or anyone with tick-borne, blood parasite type of diseases.
What about diseases that includes seizures or neurological situations?
So those cases are really case by case.
Yeah.
So some patient can be well controlled with the anti-seizure medication. In those cases, we do let the owners know of the possible risks of increased seizure activities after the surgery, but that does not totally preclude them from being a surgical candidate.
Like Lucky.
Yes.
Lucky, he had some seizures before surgery. So yeah, I remember you telling us about that as well. Now we're going to go to questions relating to prior to surgery, so before surgery questions.
Yep.
Can you please explain the importance of not jumping, avoiding stairs, fast running, sort of high impact, high energy activities? What's prior to surgery? What's the reason for this? Sort of you taking it easy with the dog and helping them to avoid these high impact, high energy activities.
So our goal for the surgery is to keep them as medically stable as possible until the day of the surgery. So meaning we want to avoid the event of congestive heart failure. So with any excess activities, jumping, sprinting, chasing birds, all these activities could lead to a onset of congestive heart failure. And sometimes congestive heart failure could be managed by medical therapy, but sometimes dogs do not make it through. So that's why we tell clients to keep their dogs as sort of calm as possible so that you don't have an event of congestive heart failure prior to the surgery.
Yeah.
And we are unable to operate on active congestive heart failure cases under the bypass because that would increase the risk for any pulmonary, conditions.
Makes complete sense. And if that's the case, if they're near to have a congestive heart failure, in congestive heart failure, obviously they have to stabilize.
Stabilize first. And then reschedule surgery.
But best to avoid these high energy, high impact activities before surgery.
Yes,
sure.
It's recommended.
So the surgery is obviously a highly invasive surgery and the body will be in turmoil after the surgery. And many international clients and folks, they struggle with the idea of keeping the dog rested and quiet during the recovery period. Can you please give the reasons for giving the body the time to heal? Time is so important. Why is this important?
Yes. So at our clinic, we generally ask clients to keep the dog as cage rested as possible for the first month.
Cage rested, yeah.
Sort of, kind of in a cage rested level of, rest.
Or fencing. Fencing maybe.
Fencing or it could be a playpen, anything, but to restrict their activity levels. And that is because after surgery, one of our most common post-op complication is the thromboembolism, which is the blood clots. And with increased heart rate, you may increase the risk of lodging of the blood clot from the heart chamber to rest of the body to cause a symptom. And blood clots can sometimes be life-threatening. So we want to avoid the increase in heart rate. Therefore, cage rest is recommended for that reason. And secondly, we only use a very, very thin suture material to do the mitral valve repair surgery. And with increase in activity, there's going to be a lot of cardiac contraction and heart movements. And that may sort of loosen up the stitches that we had placed during the surgery. And it'll probably take up to 3 months for these sutures to be hard and covered with the patient's own cells.
Dr. Sayaka, could you please explain the importance of gradually building up movement and exercise after surgery, not rushing into things?
We use a very thin suture materials to do the repair for artificial chordae tendon replacement and annuloplasty. And we're putting those sutures around a very fragile tissue. And that is why we ask patients to be in a cage rest for 1 month and very minimum exercise for the next 2 or 3 months. And reason for that is we want to first avoid the development of blood clots. And second, we want to keep the surgical sutures to stay in the place that we have placed. instead of slipping away into the tissue with increasing activities. Our clinic, for 1 month, it's more of a strict cage rest. From second month on, we allow these patients go for a 5 to 10 minute walk a few times a day. 3 months, you can increase to 20 minutes to 30 minutes per each walk. So we allow the body to get used to the increase in heart rate, increase in heart contraction, so that you don't suddenly put too much force onto the repaired mitral valve.
And would you suggest to gradually build up the activity or just go straight into it?
Oh, definitely. We ask patients to gradually increase the exercise time and amount.
Yeah. And I always think of it as within human open heart surgery, they wouldn't sort of recommend the patient to go out and run a marathon after four months or 5 or even 6 months. I always think, okay, gradually build up, and certain things, in case of my dog anyway, I sort of was really strict with him not doing, and just bit by bit build it up. Would you agree? Would you sort of agree that it could be compared a little bit with the side of human
Yes,
surgery?
definitely. I agree with the comparison.
Now we're coming to something that a lot of people have questions about, which is dental questions. So many dogs suffering from mitral valve disease have dental problems, and people ask whether it's safe to do dental work before the surgery or better to wait until after the surgery, and if so, how long should one wait?
Okay. In regards to prior to surgery, it's really up to your cardiologist or veterinarian's opinion whether your dog can tolerate the general anesthesia and have the dental procedure done. So for us, it doesn't really matter. It's really up to your veterinarian to say it's really important, so we have to do it, or okay, we can wait until the surgery is done. So we don't have any recommendation prior to the procedure. And as for the post-operatively, because our patients are on the blood thinner to prevent the blood clots for 3 months, so during that period, these patients are in sort of bleeding tendency, so we don't recommend any unnecessary procedures.
Yeah.
So I would recommend patients to wait 3 months post-surgery and also wait 2 weeks after discontinuing the clopidogrel. That's the name of the blood thinner medication. And then you can do the dental procedure.
Okay. Does it vary a little bit, or is it sort of generalization?
That's a generalization, but let's say if the patient's heart condition isn't totally well stabilized, I would say, if the patient still has moderate to severe amount of regurgitation despite the surgery, the dental procedure can be done, but with some caution.
Yeah.
Yeah.
And then maybe, I guess, tell me if I'm wrong, but also you could wait longer if it's not that severe.
Yes, of course. Of course.
Needs to be done. Now, many people don't know actually that you are head of Chinese and herbal and holistic medicine. What opened up your interest for alternative medicine and holistic medicine practice?
Right. I started to have interest in that area of holistic medicine from 2 years after graduation, actually.
Wow.
Yes. And I was wondering, is antibiotics and steroids the only way of method of treatment to the patients? Then I started to research more if the patient's body can naturally heal. Then I found about homeopathic remedies. Then I went into acupuncture and Chinese herbal medicine. So all of these can support your own immune system or natural healing process or power to overcome disease. Of course, some stuff can be dealt with surgical procedure like mitral valve repair surgery. But other things can definitely be supported with holistic approach. So that's why I love that approach a lot, because I love looking at everything in a holistical point of view.
Uh-huh.
Yes. So supporting our patients' health surgically, of course, Western medicine is necessary.
Yeah.
But definitely you've got other method of healing these patients, which is the holistic way, I
And to
think.
support,
Yeah.
I guess, the healing as well. Thank you. When would you suggest this would be used? When would you suggest to a client this could be used? For example,
Our heart patients?
yeah. For example, what situations?
So our patients are usually geriatric patients. So they usually come with liver problems or kidney problems, not just the mitral valve disease. So when it comes to kidney or liver, it's usually sort of aging or degenerative part of disease process. And there are no Western treatment or medication to reverse or assist with the healing process. So I would say if you want to support liver, kidney, which are very important organs when you're treating even the mitral valve disease as internal medicine wise, because you need to detox your body. Those two organs are the most important detoxifying organs. So you want to support that holistically. So then you can still receive the cardiac medication to treat your mitral valve.
Great. We got that, didn't we? Liver happy.
Liver happy.
Really good. Yeah, they were still taking liver happy.
Yeah.
Liver is very happy. Thank you, Dr. Sayaka. Can you please go over the Jasmine Clinic statistics for 2023?
So from 2023, our discharge rate is 97.5%. And we don't have the statistics for 2023, but based on 2022, our 1-year survival for stage B2 was 95%. Stage C was 90%. And unfortunately, stage D, who are very severe cases, 1-year survival was 81%.
That's high. That's all very high.
So based on these statistics, we believe that having the surgery earlier in the disease, like advanced B2 or stage C, would give you a better prognosis.
Yeah. And we understand that here at Jasmine Clinic, you have several specialty departments. And could you please tell us a little bit more what they are and how you sort of link together with them?
Sure. Jasmine started off as purely cardiology department. Then we gradually started to have other departments such as oncology department, nephrology department, gastrology department, as well as a soft tissue surgery department. So they help us with our mitral valve disease patients when they have underlying, let's say, gastric issue, liver issue, kidney issue, or when we find incidental finding as a tumor inside their tummy when we do a screening test. So then we can easily refer these patients and get their medical advice. So then we can treat as a team.
Yeah. Wow. So you can sort of together, you see the full picture easier.
Yes.
You can support the animal. So you have everything in-house really that you need. You could say.
We don't have a neurologist, but
But everything else.
yeah, we get help from other departments.
Yeah, that's excellent. Wow. So good to know. And is there anything else you would like to add of importance for us, for everyone to know?
I guess the most important thing would be to go for regular checkup with your veterinarian to first find out about the mitral valve disease. And when you hear a murmur, don't wait. I would suggest to have echocardiogram done by a cardiologist. Then you would know what sort of stage your dog is at. Then you can start your treatment plans in place. And you can then plan for the surgery if the condition gets advanced.
Yeah. But just if.
Yeah.
Not necessary.
Yeah, not necessary. Because this surgery do come with post-operative complication and unfortunately death.
Yeah.
So it's not like a routine surgery, I would say. So if your dog can be medically managed, that's actually perfect news. You don't need to have a surgical intervention done. But if the medical therapy isn't stopping the heart from getting worse, then surgical intervention can be offered.
Yeah. I guess some dogs, they can actually be supported on medicine for many years.
Yes.
Yeah.
So that's why we don't strongly recommend this surgery to every single heart patient.
Yeah.
Because of the possible complications and,
Makes sense. If you can support with medicine, then that can work too.
Yes.
And then if you can add some extra herbal medicine or holistic approach.
And that would be perfect. Yeah.
Thank you so much, Dr. Sayaka Takeuchi.
My
That
pleasure.
was great. That was amazing. We are so honored and fortunate to be here talking to you to deliver all these news and all these information to our Mighty Hearts members. So thank you.
Thank you.